One moment. I need to finish my notes. Please sit still for a moment. I need to evaluate you. The device today requires that you be in perfect health. You are signed up for the experiments, right? Oh, yes. Dalton is out. She'll be out for several weeks. I'm Dr. Harris. According to your chart, you've actually had several of my inventions tested on you. They worked very well, from what I can see. Yes, let me take a couple of metrics to make sure that you are healthy enough for today's experiment. It will be a device that we will be inserting into your ears. And you will definitely need an ear cleaning before then, or the device is going to get gunked up in there. Ugh. Now I wish Dalton were on today. Both of your ears. Yes, it's a dual device. Let's go ahead and get your blood pressure. That's important. I've heard. Oh, you're in restraints. Here, put your arm out. The restraints aren't new. You're just in a different room. All right. You'll feel some pinching, possibly. Doesn't Dalton get your blood pressure before she begins? She should be. It's not looking good. Never mind. You're fine. Where on earth is this? Oh, here we are. Alright, if you wouldn't mind putting your arm back in the restraint. It's for your own safety. If you would please breathe in and out. Deeper if you can. In and out. Excellent. Same thing. In, out. Good. You seem to be relatively healthy. Any adverse side effects from experiments previous? Good. That shouldn't be a problem. Let's go ahead and take care of those ears. We will be cleaning them and then prepping them for the devices to go in. Don't worry, there shouldn't be any lasting effects. Well, I believe that you signed something that said we didn't have to tell you. It could invalidate the study. I'll let you know what it's supposed to do when it's done. No wonder you and Dalton get along so well. You're awfully chatty. It shouldn't be a problem. And you don't need to know. I don't know how your ears got so filthy. You've been in here and had several experiments done in them. Oh. I see. Don't worry, she's just on vacation. Well, you know, we work her so hard. She does so much of the grunt work around here. But she's so very industrious. It's like it never ends. Ugh. Going to need a different tool. Yes, well, we greatly appreciate our volunteers. That's why we pay you. And you are a pioneer in the field. One of the first people to test several geniuses' inventions. Really, you should be paying us, but we'll need to do something about the redness we're leaving in there. We have a solution to calm it and prep it for smooth sailing for the device. Oh, you ask a lot of questions. JX1720. That is the name of the device. Well, you don't need to know what we call it colloquially. Well, if you must know, I'm slightly agitated because I thought we would get right to the experiment. I didn't realize I'd be dealing with this. We really need to stop keeping animals in the lab. Oh, don't worry, he's fine. Just bored. What's if that? Oh. Are you sure you haven't had any other side effects? Maybe you just have an odd eardrum. How can Dalton stand doing this kind of thing? Yes, your numbers look fine. You're in perfect health. You are an excellent candidate for this device. Yes, JX1720 has been tested on someone previously to you, but I will be honest, not many. No, you have nothing to be worried about. How many experiments has Dalton done on you? Well, you trust Dalton, right? You can trust me, I work with her. She's like the golden retriever of lab cohorts. Of course you like her. Incessant. Has anyone ever told you that? Yes, I have performed the tests myself before, in the lab, before we send them up here. But I don't usually work in the testing facility. Suffice to say, it was important that I be here today. This is a very important invention. I don't necessarily want to leave in Dalton's hands anyway, even if she weren't out. You have the same issue in this ear that you had in the other, so it must be your eardrum is odd. No, it shouldn't be a problem. The device will be able to get around it. You're not epileptic, are you? Your chart didn't say so. Good. I'll be using a special light that you will need to be following with your eyes. Yes, today's experiment is a little more interactive than you're probably used to. There we go. I'm sorry, it's a little hard for me to be hiding my agitation. We're 10 minutes behind schedule. This solution should calm the swelling. and prep the surfaces in your ear for the device. It's cold, I apologize. Well, I apologize that my demeanor is not as comforting as hers. There's a reason that she is the face of the testing facility, and I work in a lab. I don't usually need to worry about a bedside, nor do I usually need to worry about chatty subjects. That'll do. Alright. Let me just tighten your restraints. No, I don't think that you'll be needing to get away. But there's always a danger of convulsion or sudden paranoia or hulking out. You know, those are the kinds of things we need to watch out for. I need to take a few notes. Would you please rate on a scale of 1 to 10 how healthy you feel today? Alright. I'll make a note of that. If you could rate for me on a scale of 1 to 10, how willful do you think you are as a person? I know it's an odd question, but that paper you signed before you came in here said that you were willing to answer any and all questions pertaining to the experiment. In a number between 1 to 10, how defiant to authority figures are you? All right. No, I think you'll make an excellent subject for this particular experiment. All right. I'm going to be placing some cold metallic things in your ears. Where are they? You might feel them move around a little bit. Well, this is JX1720, part of it. The electronic part of the device. This is going to respond to the light signals that I give you and move through your brain. It won't cause any lasting damage. Could you maybe stop asking questions for 5 minutes? Just let me concentrate. Thank you. That wasn't 5 minutes. In case you don't know how to tell time. Dalton may enjoy your inquisitiveness. I, on the other hand, try not to give away company secrets. And so I mostly just find it agitating, because as a scientist, I would love to tell you what this invention does. I invented it. Excuse me. But I am loyal to the Institute. And proprietary information is proprietary information. Something some of us forget on occasion. It's vital that there's two. They meet in the middle. They form. Stop. Excruciating. I shouldn't have given Dalton such a long vacation. I could have used her help. I mostly just want to be here to record the results. Interpret them. Alright. Each device needs fine-tuning. Before we I'm using another proprietary invention that lets me do minute work on the device that's already in your ear. I would blindfold you, but your head is restrained, so you can't really turn towards me. I apologize if it's ticklish. It's not my intention to make you uncomfortable in any way, despite my demeanor. This one seems almost ready. Don't flinch. Oh, right. You can't. I just had something very sharp in a very sensitive part of your ear. And I don't want to do any damage to the subject as valuable as you are. Or as valuable as you're about to be. Well, we've appreciated your cooperation in the past, but those were all nothing compared to what you're about to be a part of. Of course, you're still getting paid. Small-minded people. We'll even pay you double, if you'd like. I don't honestly know how the pricing structure works for all these. Dalton and Belinda deal with that. Oh, money doesn't matter. It's one of our mottos here. It doesn't matter how much it costs. Well, we don't pay you more because you don't require it. Here you are, sitting restrained in a stark lab with a strange woman you just met for $200. Well, that's on you. That looks very good. Currently, you should feel the device at your eardrum. It will not breach your eardrum. You will not have... Just checking it. Don't worry, you will not have a tear in your eardrum. It should be able to go through without doing any damage. It will feel strange. But your brain doesn't really have any nerves. So when it gets through there, you shouldn't feel it anymore. You might hear it. One moment. Those were just standard questions. Nothing to worry about. You are awfully skeptical for somebody who said they got a 3 on defiance level. All right, we're ready for the next part. It is vital. Where is my device? Where on earth did I set that? The disorganization of this lab is trying our best. No, I don't normally come up to the test rooms. The lab is far better. Anyways, there we are. There we are. It is vital that you follow this light with the eye that I tell you to. Alright? This one is your left, this one is your right, in case you don't know. Follow with your left. Do you feel anything? Alright. Hasn't made it through the eardrum yet, right? Left. Please let me know as soon as you no longer feel anything. You might hear something, but you shouldn't feel it. Right. Excellent. Moving on to step 2. Lose a little bit of vision, but this allows me to see the signature of JX 1720 to make sure that it's moving to the right location. But because we haven't made one of these for over glasses, which is ridiculous because 80% of the doctors here have glasses. You don't need to follow anymore. That was just to get through the eardrum. You can if you want. Alright. It's just a message to the device. Well, I don't expect you to understand it. You are not JX 1720. They're almost there. Almost where they're supposed to be. That looks about right. One moment. just turn something on. How do you feel? Finally quiet. Lord, absolutely incessant. I can't believe Dalton can stand talking to these people. Belinda? Yes, 18 is non-responsive and ready to be carted away. Yes, it went very well. Excellent.